Practice makes one perfect, but the opposite is also true. Not practicing makes you weak. That's just what happens when someone suffers from a type of stroke which affects one side of the body. The patient always prefers the strong side, but slowly he learns to not use the weak side. What we do in this therapy is we tie up the side that's strong, we challenge your brain to use the weak side, and we force it to make new connections. The results are amazing. Small impulses are transmitted to the nerves in your arms and legs, and these trigger movement. Movement starts when the brain triggers it. In stroke, if that part of the brain is affected, that movement will not occur. This does not mean that your muscles or nerves are weak or they don't work, they still can. But they need a trigger, aka an electrical impulse. Electrical stimulation helps regain movement even if there is a severe weakness. Now when we see the muscle, it is just twitching or slightly moving, but the actual healing is happening in the brain. Again, neuroplasticity is at work. The brain is rewiring itself slowly and steadily when combined with rehab exercises. Also, this helps patients who are very spastic or tight in decreasing that spasticity. Another therapy of much use in one-sided stroke is mirror therapy, in which a mirror reflects your strong side and you keep watching that reflection while attempting movements with both your arms as best as you can. Of course, your conscious mind knows that it is just a reflection, but the brain is tricked. This triggers neuroplasticity and mirror neurons in your brain. Here at AktivHealth, we follow a structured program called the Fitness and Mobility Exercise Program for Stroke. It helps in the physical as well as the brain functions. It also helps in reducing the risks of fractures, falls, and heart diseases. Of course, no two patients are the same, so protocols are decided for each patient individually. However, we will show you just a glimpse of all the exercises in the program. This is a 1 hour per day program and it happens twice or thrice per week depending on the patient. We see outcomes in 2 to 6 months. It begins with a 10-minute warm-up session, followed by a gentle stretching of different muscles. Subsequently, we add strengthening exercises. The next step is of course balance and agility, something that is very important in stroke patients. We do this with slow and fast movements. An often forgotten step is the next one, that is the aerobic fitness. It is great for the heart and blood vessels, and it also increases the vascularity and the blood flow to the brain. We end with a cool down session that is similar to the warm-up session.